Welcome to our 5 on 5. We're pleased to be joined by William North, the CEO of Community Health Center. William, pleasure to see you. How are you today?
Good, Greg. How are you doing?
I'm doing very well, thank you. So you're new to the position, just took over as CEO last week, correct?
That's correct.
Okay.
Yeah.
So tell us a little bit about yourself.
Well, I come from Colorado. I've worked in community health centers for many years and really got attached to the mission of taking care of individuals who faced access barriers to health care over the years.
Mm-hmm. So what drew you to this particular position and here in Southern Oregon?
Well, I think Oregon in particular is a beautiful place to be. Spent much time up here as a child. My parents would come up to the Pacific Northwest, so very familiar with the area. Medford particularly, the opportunity to work with an organization like Community Health Center with a long history, strong community support was very attractive.
Mm-hmm. Yeah, and Community Health Center is very, very active in our community now as much as ever. What are you guys doing right now that you're particularly proud of?
Well, we've really been focused on healthcare reform, and in the last, I'd say, 3 to 6 months, focusing on bringing patients into the system, completing our structure relative to that, because it's really changing fairly dramatically.
Mm-hmm, absolutely. Okay, and partnerships in the community is something you guys kind of look for or thrive on?
We do. I look at a community health center as really being an organization that works with the medical community, with the hospitals, with the insurance companies, with the CCOs, with medical specialty providers, with dental clinics, with human services, with the health department. So we have many relationships where we can really develop those systems of care, that continuum of care for those patients who face access barriers.
Absolutely. All right, we're going to take a quick break. Much more with William in a moment. Stay
Very good.
Us. Welcome back to our 5 on 5. Again, we're here with William North, the CEO of Community Health Center. William, we're talking a lot, I think we briefly touched on it before about the Affordable Care Act. Now, this is something the health community has been looking for and preparing for some time, correct?
Yeah, I think, Craig, even though the ability for individuals to have insurance coverage January 1st began with the open enrollment in October, healthcare providers have been working on this for a number of years. And I think it's not new in terms of the changes that we're experiencing, but what is new is that there are a significant number of patients who previously did not have insurance coverage and now have coverage, and trying to make sure we've got systems and support services to provide care to all of those patients has been the big challenge.
Mm-hmm, yeah, and one other thing we see a lot of, I guess, lately is the change, obviously, with technology. You guys are moving more towards an electronic system with records, correct? Is that something you guys are continuing to do?
It is, and I have to tell you, that's something that I'm very, very excited about. As I've worked in healthcare for about 20, 25 years, there was always the inability to track a patient's care completely and then track it to a population. So when you're looking at patient outcomes, healthcare really didn't have the ability to manage that as well as we would have liked across providers and then certainly across the lifespan of a patient. With electronic record, we're able to pull up information about the entire population that Community Health Center sees. And by looking at that, we can look at how well are we managing diabetic patients, or how well are we managing hypertensive patients, or how many of our patients really face a certain barrier to care, and then use that data to, first of all, improve healthcare outcomes, secondly, to improve the quality and the customer service that we provide, but then really to design programs that meet the needs of our patients even more.
Very good. Okay, now I wanted to ask you about branching out in the community. You guys have expanded your service in the Valley in Southern Oregon, correct?
We have. In the fall of 2012, we went to Butte Falls and opened up a clinic that's really a very interesting clinic because it's somewhat of a hybrid between a community health center and a school-based clinic. And we have the site within the school administration building in Butte Falls. And that clinic then is open to the community at large. So it's a very innovative approach to really taking a core community asset, a school, and really using that to leverage healthcare services for those patients. This year, just starting in January, we extended it even further up into Prospect. And so we've got a clinic up there working with the school district there. So school-based health center is really an opportunity to address the needs of kids first and foremost, but then also to reach the community at large.
Well, it sounds like you're a busy man. Congratulations on your new position. We look forward to seeing you again in the future.
I appreciate it. Thank you, Greg.
All right. Stay with us. We'll be right back.